Welcome to a presentation about assessment and evaluation in contemporary nursing, a reflective process. I'm your host, Billy Raschow, and I am a candidate in the Master's of Science in Nursing Education program at Excelsior College, and my professor is Dr. Mosca. I sit back and relax and enjoy as we discuss the importance of evaluation in nursing programs and curriculums. Reflection is a process of looking backwards and reflecting upon certain events to promote deeper understandings and connections. According to Billings and Halstead 2016, quote, reflection is helpful in demonstrating how to become a lifelong learner, unquote, page 258, a necessary quality of the contemporary nurse. Reflection is also important in the evaluation of the nursing process as well as programs and curriculums, as it helps to ensure students receive quality educations. Evaluation also tests for programs and curriculums for the validity, and it measures curriculum and program outcomes against benchmark standards to help identify deficiencies and needs for revisement. It helps to determine internal and external influences that determine a program's effectiveness. Helps to also understand if outcomes fulfill a university and institution's missions, visions, and philosophies, and as well as the School of Nursing's mission, visions, and philosophies. It also helps determine if programs have been implemented and they're doing what they've intended that they will do. And lastly, they identify available resources, how resources are utilized, and how they will be used in the future. The first and most important step in the reflective process is to understand what an individual knew prior to the new instruction or learning. Things that I knew prior to learning nursing evaluation and its importance in programs and curriculums is metacognition. I understood how to connect old learning with new learning and to think about what I was learning. Ways of knowing and how the ethical, empirical, aesthetic, and personal knowing, as well as emancipatory knowing, helps ask critical questions and do reflective processes that help stimulate new growth and new learning. Philosophies and frameworks and models were also had previous knowledge of. Bloom's taxonomy of learning, knowledge of rubrics, feedback, the importance of scaffolding, and using Vygotsky's zone of proximal development whenever a student is near understanding a concept but still needs facilitation from the guide on the side and not the sage on the stage, and the importance of interprofessional education and how we must use these opportunities to gain mutuality and respect in the health professions. Scholarship of teaching, integration, excellence, and lifelong learning are also concepts and processes that I had previous knowledge of prior to nursing evaluation. The next step in the reflection process is synthesize knowledge or what an individual has learned from the course. Things that I've learned from the course that are extremely important to nursing evaluation are the backward design model, Kirkpatrick's model of evaluation, test blueprints, reliability and validity, the discrimination index and biserial correlation, inter-rater reliability. I've learned the importance of analytical and holistic rubrics, evaluating achievement through competency-based outcomes, the integration of multiple technologies, evaluation in academic and non-academic settings, such as the online programs, such as Excelsior's course that we're currently in, and how the Quality Matters rubric with its 8 essentials help understand if nursing programs that are online are receiving the results and achieving the outcomes that they have desired. I've learned about the accreditation processes as well and the importance of the organizations such as the CNEA, the ACEN, the AACN, the QSEN and the NLN, and how they have competencies and essentials for baccalaureate and master's nurse educators to help maintain validity in nursing programs. I've also learned the importance of mapping outcomes and how using end of the learning program student outcomes and making sure that they correlate and students they align with the program and curriculums outcomes is very important in nursing education, as well as strategic plans of evaluation to help nursing programs understand where strengths and weaknesses lie and where revisions may need to be made. Upon completion of nursing assessment and evaluation in nursing education, there is an application process of knowledge and how this knowledge will be used in the future. Knowledge is just like paint as it reads. It is not good unless it is applied. I have used Excelsior College's course outcomes for this program to identify the things that I will be capable to do with completion of this course and program. And that will be to integrate philosophical and cultural, political, economic, and professional standards in evaluating curriculum and educational programs. I'll be able to critique strategies for evaluating learning outcomes in academic and non-academic settings to improve learning and promote continuous quality improvement. I'll be able to help design tools, evaluation tools that measure achievement of learning outcomes in cognitive, affective, and the psychomotor domains of learning to assess the knowledge, skills, and attitudes that are necessary of nursing generalists. I'll also be able to incorporate evidence-based assessments and evaluate strategies and knowledge of social, ethical, cultural, legal, technological, and interprofessional principles in the evaluation process. As you can see, the evaluation and assessment process in nursing education is one that is intense and it's very comprehensive. Also, using Carper's ways of knowing is a great way of a nurse's ability to reflect on personal experiences and grow further in their personal and professional lives. According to the personal knowing, what I've learned through this experience that no matter the challenge, endurance and perseverance are keys to achieving success. I've also learned how important that other disciplines are to providing effective communication to improve concepts, processes, and patient outcomes. It is through self-reflection that we learn from our daily endeavors and become more keen to developing critical thinking abilities. According to empirical knowing, through the spirit of discovery and inquiry, important information that is scholarly in nature has illuminated evidence-based information that engenders a community of knowledge about nursing education and the evaluation process that will follow me and support me as a competent nurse educator. Ethical knowing, my personal philosophies of caring, compassion, integral being, and holism have further been supported by coming to understand the importance of using frameworks and models that support holistic, culturally sensitive programs and curriculums in nursing education. Aesthetic knowing. Through my personal, empirical, and ethical knowing, I will be able to participate in interprofessional educational and collaborative processes that will further promote nursing as a profession and will be able to convey to students of the important gift of nursing, caring, and compassion. Emancipatory knowing. Having the ability to reflect and identify areas in need of improvement by asking the critical question, what is wrong with this situation? Learning about the importance of a systematic evaluation plan in nursing education, nurse educators will be able to look deep within the portals of programs and curriculums to see where deficiencies lie and use collaboration to strategize on how and why to revise content to be able to achieve previously unsuccessful outcomes. I hope you have enjoyed this presentation. This has been a very rewarding experience, and I look forward to the future with all of you. And I hope that everyone has a great holiday season. Merry Christmas.